or multiple white matter lesions is dramatically increased when your homocysteine is just greater than 13.8. I see that number every single day. Well, here's a fellow who comes to see me. He's confused. He says, I think I had a stroke. I've learned, after doing this for many years, that when people tell you they think they've had a stroke, they're most of the time correct. He's had strokes in the past. He has risk factors, hypertension. He's on some medications, Hyzar, Plavix, Prilosec. The usual suspects. Here's his examination. He's alert and cooperative. He does not know the date. He does not know the year. He knew the month. He knew the name of the president. I'm not sure how to score that. He knew the number of quarters in $1.75. And his mini mental status test, it's a very quick neurologic exam, is very, very abnormal. Anything under about 28, and you have issues. So deep tendon reflex is very brisk, indicating something upstairs, cerebral, is happening as opposed to being peripheral. Here's his MRI scan, which shows multiple white matter abnormalities. So here's his examination. And what do we see in this gentleman? I'll put arrows. What do you think that is in the corners of his mouth? Angular stomatitis. And that's a clear indication generally of B vitamin deficiency. So he's at risk for B vitamin deficiency, and so, in fact, his homocysteine is dramatically elevated, 16.6. When I say dramatically, I see levels in the 20s and 30s sometimes. Anyway, let's look at his medications and see if there's any risk factor there. I just talked to you about Sinemet, but Prilosec. Well, what does Prilosec do? It's used to block stomach acid, but we need stomach acid. We need stomach acid to help activate intrinsic factors so that we can absorb vitamin B12. When people take Prilosec, they become B12 deficient. So people on acid-blocking drugs should be monitoring their B12 status. What better way to monitor B12 status? Well, there are probably better ways, but homocysteine is a nice indicator of that. And yet these drugs are sold over the counter now, as you know. I mean, these are you watch the evening news and you have these people eating the wrong foods, becoming upset stomach, and they say, take an acid-blocking drug. Well, if you really thought about it, if you want to digest these foods, you should have more stomach acid. That's how you activate your digestive enzymes. But yet, this is what people do. And when they start taking these acid-blocking drugs, they stick to these people like luggage. They're with them for the rest of their lives. No one ever takes them off because they're so-called innocuous, right? Well, as we talked about, it inhibits B12 absorption. And come on. Next slide, please, if you can, because I can't seem to. I'll try enter. Oh, off we go. So for some reason, if Mark could come back and work that for me. Can you hit the next slide? Anyway, so the point is that, this will be fun. The point is that when you inhibit B12 availability, homocysteine goes up. We should always pay attention to medications that people are taking, because so many things inhibit not just B12, but folic acid, vitamin B6, and these are important players. This is why people on these medications should absolutely be on just a B complex. So what did we do for this gentleman? We placed him on high levels of things that we use to lower homocysteine, like trimethylglycine, began him on a series of B12 injections, raised his B6, his folic acid, and N-acetylcysteine is actually very helpful in lowering homocysteine as well. And thereafter, the patient was stabilized. That'll work. Can we try this? Oh, wonderful. Look at this. Look at the drugs that deplete vitamin B12. So let's see if this works now. Okay, and here's some very important players. Metformin, ranitidine, the acid channel blockers, and drugs that deplete folic acid. I won't go through them because you have them in your syllabus. Here's what we did, as I mentioned. We also put him on vinpocetine. Vinpocetine is an extract of periwinkle, which has been clinically proven to improve what are called the rheological properties of the red blood cell, making it more deformable so it can travel through smaller vessels. His homocysteine lowers to 9.2, and that's a big deal for me and him. Is there a relationship between homocysteine and Alzheimer's? You bet there is. These people speculate that because of the relationship of homocysteine to brain degeneration, and this is published in the journal Lancet, progression of vascular dementia in patients with identified elevated homocysteine could be prevented with vitamin supplementation. The V word. My colleagues are sure reluctant I have to redefine what that means, my colleagues, because I feel more at home in this room, are reluctant to talk about vitamins. But now there's, I guess, is it called Foltex? There's a prescription form, so they didn't end the day by giving out vitamin recommendations. They wrote it on a prescription pad. Thank goodness no one else will find out. The amazing thing is, though, that I see these people as patients. These doctors come to me they come into the office always late in the day as patients because they're having issues. But so they give them this option of using Foltex as a prescription way, and it's good. It has some B vitamins in it, but it's triple the cost, as you know, of a good multi-B complex. This study looks at Alzheimer's disease and looks at the risk of Alzheimer's related to homocysteine and also carrying the ApoE4 gene. If you carry the risk of Alzheimer's, the frequency of having the ApoE4 gene was dramatically increased in the Alzheimer's patients. The risk of elevated homocysteine was significantly increased in the Alzheimer's group as well. And what the conclusion was, again, coming from the New England Journal of Medicine, where they looked at risk of Alzheimer's based upon homocysteine, published in the New England Journal of Medicine. I think we'd all agree that's a pretty respected journal. Found on the bottom that if your homocysteine is greater than, or equal to actually, 14, the risk of Alzheimer's disease nearly doubled. Doubled. If we lower homocysteine levels, that's a great thing to do. If we fortify foods with B vitamins, or if we as doctors recommend people having their homocysteine levels checked, we're doing people a heck of a good service. Many times when I do a lot of phone consultations with patients from around the country, and I say, okay, before we get together next, I want you to go to your local doctor, get him or her to do a homocysteine level. We'll get back in touch and we'll figure out what to do next. Doctors won't do it. They say, I never heard of it, or I've heard of it, but it's not important. High homocysteine will double your risk for Alzheimer's, a disease for which there is no cure. The disease that most people fear more than anything else, more than cancer, more than heart disease. As you sit here today, your risk for Alzheimer's, if you plan to live to be age 85 years or older, is 50-50. A flip of a coin. And here's something that actually increases your risk as well. Is there anything you could possibly do that could reduce that risk? Well, there's tons of things. I wrote a book about it. But what the peer-reviewed literature shows us is that having a lower homocysteine and having good levels of antioxidants on board will lower your risk. There's no real glamour in preventive medicine, I would guess. You know, when you're a cardiovascular surgeon, a person comes in having an acute event of coronary ischemia and myocardial ischemia, and you do a balloon angioplasty or a bypass, that's big time. You know, you're the hero of the day. But when you say, if you do these things 20 years from now, your risk of Alzheimer's is going to be reduced by whatever, that's not looked upon as being heroic. But as the Yellow Emperor, 4th century BC, China said in the Neijing, that prevention is the ultimate principle of wisdom. To cure a disease after it has manifested is like digging a well when one already feels thirsty, or forging weapons when the war has already begun. So here we see that Alzheimer's is greatly predicted by having an elevated homocysteine. So we should be checking that, because this is a time bomb. So our task then is to put out this fire. That's what we've got to do. We've got to cool off the brain. So let's look at some of the things that we can do to actually enhance mitochondrial activity. We can, as a matter of fact. And the first will be coenzyme Q10. Studies have demonstrated long ago, back in '99, that the amount of superoxide production in various species is inversely proportional to coenzyme Q10 levels, giving us the first ideas that maybe CoQ10 had an effect on mitochondrial function. Improving mitochondrial function would decrease superoxide production, a very dangerous radical. Dr. Schultz and Beal at Harvard measured CoQ10 levels in the platelet mitochondria of Parkinson's disease patients and compared them to controls, and found that they had lower levels. Interestingly, look at the spouse of a Parkinson's patient and note that their CoQ10 levels are lower as well. That really does speak to something environmental, that they're sharing an environment. They both live on the farm. They both are exposed to the pesticides. So here's studies from 9 years ago showing us that Parkinson's patients have deficiencies of a brain protective